Let's now move on to masking and stigma. We know the research and the science shows that N95 masks reduce the risk of transmission and they reduce the risk of getting COVID-19 and other airborne respiratory viruses. This is science. This is a fact. Yet masking has become so stigmatizing and so politicized that people aren't believing or adhering to the science. So this research study spoke about masks and stigma. There are mixed messages, misinformation, and lack of medical and scientific knowledge about COVID-19 and masking that can create a lot of uncertainty. Masks have become to symbolize a perceived threat to freedom. There's discomfort around people that wear masks and discomfort wearing masks. There's polarized relatedness. It's become you're either this side or this side, and there's no connection in between. There's negative attitudes towards people that mask. There's a sense of being a social outlier. Whenever I go into a indoor public setting wearing my N95 masks, there are always looks, there are always comments, some of them positive, some of them degrading. We need to look at masking differently. There can be a sense of non-compliance and anger and derogation of the source. Well, I'm not wearing a mask. Why are you still wearing a mask? There's tremendous isolation with the stigmatization of masking. And there's cognitive dissonance. There's so much misinformation. We are not making sense of what masks are really about. They're about the basic science of preventing, getting, and transmitting airborne respiratory viruses and protecting our lungs. So we need to combat mask stigma. We need to arm ourselves with the truth and the facts about what masking is about. So the World Health Network has all this information about why we are still wearing masks. So to answer the question, isn't the pandemic over? The short answer is no. The emergency phase is over, but because the virus is still mutating, it is still highly transmissible. We are still in another wave of the pandemic. But I want things to go back to normal. So do I. So does everybody. But we also have new knowledge that can help us keep each other safe and healthy. So normal needs a 2025 update with all the information that we know. I think you're living in fear. Short answer is it's not fear. It's applying what we know. Like wearing a seatbelt or a bike helmet, wearing a mask is simply a sensible precaution so we can go about our day with peace of mind. But you're not high risk, so why bother wearing a mask? Because preventing transmission matters for everybody, not just people in vulnerable groups. Are you going to wear a mask forever? Hopefully not. But masks are a tool we can use when and where it makes sense. Indoors, in healthcare settings where people go because they are sick, in poorly ventilated areas, or when community transmission is high. For example, if there's an outbreak in a school, it makes sense for everyone to wear masks to prevent it from getting worse. If there's a community outbreak, it makes sense to wear a mask so that it doesn't get worse, and so that the healthcare settings have an opportunity to address the issue and bring the illness down. My doctor doesn't wear a mask. Well, healthcare professionals are humans too, and institutions vary in their policies. And even if they've made that choice, it doesn't change the science behind airborne transmission or the benefit of masking. I ask my doctor if they will wear a mask. Would you please put a mask on? There's no problem in asking that. I think kids need to train their immune systems. Aren't you preventing that? A child's immune system does not need to encounter dangerous pathogens to develop. Everyday exposure to common microbes is enough. The COVID-19 virus, we have to remember, in lab settings is a level 3 biohazard. We would not put children in a room with West Nile or with tuberculosis to train their immune systems. COVID-19 is the same level as those dangerous diseases. Won't constant masking weaken your immunity? The answer is no. Masks don't block all microbes. Our immune systems still get plenty of stimulation from daily life. And we are not masking 24/7. We are masking in high risk situations. So why bother with open windows and air purifiers? Well, improving indoor air quality is one of the most effective ways to reduce viral particles in the air. So we need to reduce the viral particles in the air. We need clean, fresh air to breathe, and we need to prevent transmission of disease. So why would you wear a mask if you're vaccinated? Those are two different things. Vaccination helps with the immune system, and masking prevents any new variants and particles in the air from getting in. So there are two different layers of protection. When people are mask wearing, there is a sense of psychological autonomy and altruism. The first step is risk assessment. We need to assess the risk of contracting a disabling airborne respiratory disease, and that outweighs the risk of being stigmatized for wearing a mask. Those of us that continue to mask are stigmatized. We know that people who don't have the right information are going to make comments. But for us, the risk of contracting a disabling airborne virus, destroying our lives, as those of us with long COVID know, that risk is much higher than people making ignorant comments. There's a sense of psychological autonomy when we choose to wear a mask when other people do not. It is our choice. I choose what happens with my body. There's a sense of self-reassurance of utilizing a known safety precaution. My mask is the same as my bike helmet. It's the same as wearing sunscreen. It's the same as wearing hearing protection. It's the same as wearing steel-toed boots when I'm doing heavy work. It is a safety precaution. The emotional experience of wearing a mask is feeling a sense of care and protection. It's knowing you're protecting yourself. It's knowing you're protecting other people. It's knowing that in these uncertain, very challenging pandemic times where the pandemic is not over, we're in another phase. It's knowing that we are doing the best we can. And there's a sense of altruism. There's a sense of community care while wearing a face mask. When we greet each other wearing N95 masks, there's an eye smile and a nod and a sense of acknowledgement that we are caring for each other. So we need to think about mask wearing differently. Wearing a mask is no different than wearing glasses, than wearing a hearing aid. It's a device that helps us with what we need help with. Wearing a mask is no different than wearing a seatbelt. There's no difference there. Wearing a mask is no different than a bike helmet, than high visibility students at a crosswalk. It's keeping them safe. It's no different than wearing a hard hat. Wearing a mask in public health settings in schools. Those are high risk areas. We are keeping people safe. Wearing a mask. No one wants to cause harm by wearing a mask. They just want to protect themselves and each other and care about the future of humanity.